HealthPartners Canada just released a new survey, a new report that the numbers are quite staggering when it comes to chronic disease and major long-term illness and what that connection is with your mental health. And here to tell us more about that, we were joined by Eileen Dooley, CEO of HealthPartners Canada, and Myra Conway, who is a volunteer with HealthPartners Canada. Welcome to the show. It's great to have you both here.
Good morning. Thank you.
Eileen, this was a very important report to come out with and raise awareness. Maybe you can share some of the numbers and what's the significance of this report?
Sure. We're a collaboration of 16 health charities across the country, and collectively we know that 87% of Canadians are likely to be touched by one or more chronic disease. But what we haven't done is make the connection to depression and mental illness. And we know that there's increasing attention being directed towards mental illness, and we thought it was important to actually try and draw the link between that. So what we discovered is that of those 87% of Canadians that are likely to be directed by or affected by one or more chronic disease, 25 to 50% of them are likely to suffer from depression at the same time. And if you have a chronic disease and you suffer from depression, your mortality rate is likely to be much more significant than those that don't. And so it's an incredible challenge for people who have a chronic disease or who are a caregiver, who are suffering from caring for someone else and suffering from depression. And the cost to the Canadian economy is absolutely staggering.
What kind of numbers are
about
we talking?
$191 billion every year in terms of lost productivity and disability costs, because 500,000 Canadians every single day miss work because of depression.
That's high, right?
Yeah, it is. It's staggering.
It's a staggering number, and we were saying earlier that it's surprising but also not surprising based on, a lot of awareness that's being brought forward now. And as I understand, the Federal Public Services now, as of March, has made it a top 3 priority. Can you elaborate a little bit on that?
Well, yes, the Clerk of the Privy Council has identified it as a significant issue, as many leaders in workplaces have, because they are the ones that are seeing the increased cost of disability, the increased number of people that are either absent from work or at work but not really present because they're worried about either their own health or the health of a loved one for whom they're caring. And so we work exclusively in workplaces with employers, and we are seeing more and more employers identify this as a top pressure and a top concern for them. For us, we realized that people weren't making the link between chronic disease and depression, and so that's what we wanted to do, to say mental illness, depression is not a standalone problem. Often there are very significant links with those who are either caring for someone who's ill or who are ill themselves.
Yeah, I want to ask you about that, Myra. Your husband was diagnosed at a very young age with a form of dementia. I believe he was 57 years old when he was diagnosed.
That's right.
Not only the effect on him, but what about the effect on yourself? Did you have any challenges yourself as he went through this?
I think that I was very lucky because I was never actually diagnosed with clinical depression, although I think there were many times when I was very sad. The reason I was very lucky was because extremely early on and throughout the entire length of Michael's illness, I went to a support group that was put on by the Alzheimer's Society for spouses of people with that young age dementia. And that support group was my lifeline. For the 7 years of Michael's illness, I went every month, and I very seldom missed a meeting because that was so important for my support.
Of course. And then you've decided even still to volunteer. What sort of support happens with the Alzheimer's Society?
Well, the Alzheimer's Society has 2 different sort of focuses, and I'm not the expert on all that they do, but they have support groups for spouses of people with dementia, for actual people suffering from dementia, from families in general. But they also have, and that's the place that I volunteer, a lot of information services, so that I do a lot of public speaking in the community to inform people about what the Alzheimer's Society offers and the kind of information that you can obtain from them.
We're so grateful to have you here today, because I think when we talk about depression and awareness, all too often we forget about the people who are supporting people that are suffering from it. And what are some unique ways that you think that community might be able to become more involved in supporting people that are experiencing depression?
I think one of the things is to simply understand, to recognize that people who are supporting family members are themselves, I say, are themselves suffering from a chronic disease. And I call that, and I think just to simply understand that, to just, I had a friend who would invite me out for a coffee once in a while. And just knowing that there was somebody who would do that was so important to me.
I can imagine. And Eileen, in these situations, oftentimes we sort of stand back, right? If a family member or a friend, they need their time. We better give them space.
Right.
I think maybe we're going about it the wrong way.
Well, I think it's important to be able to ask if there's something that you can do, and is everything okay, or can you help? And the other thing that's important to know is in our report, we actually identified programs in addition to those offered by the Alzheimer's Society that are offered by all 16 of our national health charities here in Ottawa and in every community across the country that are there for people in need. And so there are supports available. There are folks that can work with individuals in time of crisis.
Moving forward with this report, now that it's come out and, obviously raising awareness, doing things like this, what is the next step? What is the next stage for HealthPartners Canada?
Well, we're actually now starting to look at children's health, and we want to make the link between the work that our charities are doing, because often, again, people who are suffering from depression and caregivers might be people like Myra who are caring for a spouse or a partner, but there are often a lot of moms and dads that are caring for children that are diagnosed with cystic fibrosis, diabetes, other diseases like that. So that's what we are moving on to next. But this is going to be a core piece of work for us as we continue.
Myra is one of many sort of ambassadors and people that have spoken out. There are other stories that are shared as well on a website. Can you perhaps tell us a little bit about that?
So what we have is we've got a website, and it's called I Am Living Proof, and it's people whose stories, and people share their stories of how they have been helped through donations to HealthPartners, because what we do is raise money, we give it to our 16 health charities, and they in turn help individuals suffering from chronic disease or their loved ones.
And your website is obviously a great resource for people that need help, that are looking for support, such as Myra was looking for.
That's right. It's either healthpartners.ca or iamlivingproof.ca.
Terrific. Eileen, Myra, thank you so much for being here.
Thank you.
Really appreciate it.
Thank you so much.